I don't have to do special tests to tell me that you have inflammation. It doesn't help me in treating it. Doesn't help me in treating it to know what your complement levels are and your immunoglobulin. All I need is to see if your immune system is ramped up or not. And I can do some very simple tests with that. I can look at your lipid numbers. And your lipid numbers, particularly your triglycerides and HDL, will tell me whether you got an A or a B pattern. I don't need NMR. I don't need all this sophisticated breakdown because it just correlates and corroborates what I already know. I'm going to look at your blood sugar. I'm going to look at your hemoglobin A1C. I'm going to look at your iron studies, in particular your ferritin. It's a marker of intracellular inflammation. I'm going to look at your male or female hormones in both my males and my females to look at what insulin's doing and look to see how the sex hormones, I hate that word because the hormones are associated with sexuality and gynecology, but they really have many, many other roles to play. Like every cell in the male or female body has an estrogen receptor. Why? It's got nothing to do with sexuality. It has to do with inflammatory processes. So we're going to look at those markers. We're going to look at CRP as an acute marker, C-reactive protein, highly selective CRP. We're going to look potentially at homocysteine, but I don't care if your MTHFR gene is elevated. Homocysteine is just a marker of inflammation. I very rarely even do it. We did some studies with homocysteine way back. We did some studies with IGF. It was a promising marker, but I don't need that to tell me about your level of inflammation or to track it. So I'm doing a science study, yes, but anybody that's ordering those markers doesn't really have significant value. We don't do lipid markers in terms of omega-3 and omega-6 ratios because that's in the blood and I don't care what's happening in the blood. I don't do leptin. I don't do any of that garbage that is a waste of your blood and a waste of your money and a distraction. But I will look at uric acid because that's a very powerful marker of inflammation. I look at an ANA. I will look at a rheumatoid factor, RF, anti-nuclear antigen and rheumatoid factor, and I'll be able to interpret those in terms of autoimmune disease. As long as we got the baseline, we can tell about your inflammatory system. We don't have to do the deep dive that I'm going to talk about in detail in the next video. It's unnecessary, it's a waste of time, and it's a distraction. And once we see your level of inflammation, we can then begin to counter that, not with a whole bunch of product, that interferes or dumbs down the immune system and dumbs down your inflammatory system. That's just doing its job. But let's take away the cause. Let's identify and take away the cause, help you to take away the cause and to understand the cause of that inflammation. And that's the focus of my practice. As a metabolic health specialist, if you dumb down the system that's protecting you, you're doing yourself a disservice. We may have to dumb it down slightly for a little while to protect you from dying of a heart attack or a stroke. But long term, what we want to do is get rid of the cause. Let's get rid of the cause. And if we do that effectively, if you're willing to work on that, you are going to be healthy from every perspective. And you're going to be able to respond and react in a healthy way to your body. One of the things that really bothers me, and when I was in the laboratory, when I was a young doctor, we had a moratorium on doing this. Anytime you see a drug being advertised on TV that it's got some crazy name and ends with an MAB, monoclonal antibody, or infliximab, anytime you see those crazy products being advertised, those are monoclonal antibodies, single antibodies that interfere with your inflammatory cascade. And yes, they help to heal a certain part of that. But now your inflammatory system is dumbed down and cannot effectively take care of other parts of your body. So it's fine to use those medications to get control of a particular inflammatory system for a short period of time. But why don't we address the cause so that you don't need those very powerful medications that completely screw you over when something else happens? You get COVID, you get an infection, you get tuberculosis, or whatever it may be. When you are on those medications, your body loses its ability to fight against them. You cut yourself. Anybody that's on Xarelto or blood thinner knows that they bleed like crazy. I was going to use an analogy there, I won't. They bleed like crazy. So yes, you're protecting yourself from clotting in your blood vessels, but you're now putting yourself at risk. You bump your head, you bleed inside your head, you bleed into a joint. Ask any hemophiliac how horrible that is. That's what these drugs do. And why don't we then correct the reason why you have that inflammation first and foremost? Surely that's going to protect you and yet allow your inflammatory system, allow your clotting system to work normally against all the other problems you may encounter. There's logic behind this, folks, but there's no money behind it. That's the problem. I don't have a product or a drug to sell you. So if you're spending money, or your healthcare system is spending money on drugs to counter your inflammatory system, and you have not been educated and you don't understand what the cause of, nobody's talked to you about the cause of this and made the cause go away, you're doing yourself a massive disservice. Or, worse still, you're being manipulated and taken advantage of by those people selling you those drugs. And they may be well-intentioned, but they don't understand what I've just talked about.